Hello everyone. Today we'll be talking about how to approach a evaluate a head CT scan. So basically, if you're given a head CT image, how are you going to evaluate it, right? So this is basically a diagram showing the head CT. This is another diagram showing the head CT. So let's check now. This is the bone, the skull, right? So the sylvian cell curves. This is our cerebral aqueduct. This is the midbrain. This is the third ventricle, and this is the corpus callosum genome. And this is head CT, so just normal anatomy, okay? So A, which is the first image, it's at high midbrain level. B is at the basal ganglia region. Then on this one is A is the showing the lateral ventricles, and this one is very important. Most of the times we're evaluating head CTs for hemorrhage, we usually look at this level, the level of the lateral ventricles. Then B, this is the upper cortex. So approach to a head CT scan. So try to remember the mnemonic. Blood can be very bad. So what does it stand for? B, C, B, V, B. So B will start with blood, C, cisterns, B, brain, V, ventricles and bones. So blood is not usually supposed to be seen on normal CT, right? So we won't be able to appreciate that here. So let's talk about brain. So this is the brain. This is brain matter, okay? So we need to look at that. Then the ventricles. These are our ventricles. You always need to check for this. Is there any blood or anything in there? Then bones B. So this is the bone. So you need to check this for any fractures. So let's get into it with details. So step one, blood. So you need to look for any evidence of bleeding throughout all slices of the head CT. So you need to take note that blood will appear bright white and is typically in the range of 50 to 100 Hounsfield units. So it will be bright white, okay? Basic categories of blood in the brain are epidural, subdural, intraparenchymal, intracerebral, intraventricular, and subarachnoid. So basically, epidural above the dura mater, right? Then subdural below the dura. Then intraparenchymal or intracerebral, that's into the brain tissue. Intraventricular in the ventricles, and subarachnoid in the subarachnoid space. Then epidural hemorrhage is lens shaped and it does not cross suture lines. So let's look at this. This is epidural. Remember we said that blood is going to appear as bright white, okay? So this is epidural, lens shaped, it does not cross suture lines. Then this is subdural. This is crescent shaped and it does cross suture line. So you're able to see this? Yes. So this is acute blood. Then we go to intraparenchymal or intracerebral hemorrhage. So this is this. Remember we said intraparenchymal or intracerebral, that's basically bleeding into the brain tissue. Then intraventricular hemorrhage. Remember how our ventricles are supposed to look? It's supposed to look like this. If we look at it here, we're able to see the color has changed to bright white. So that's basically bleeding. Then subarachnoid hemorrhage. So this is the subarachnoid hemorrhage. Yeah. So cisterns. So there are two key questions that you need to answer regarding the four key systems. So what are the four key systems? You need to know that. Circummesencephalic, suprasellar, quadrigeminal, and sylvian. So what do you need to know about the system? So you need to ask that is there blood in the systems? Yes or no? Are the systems open? Yes or no? Let's look at the systems. So this is a diagram that's showing our circummesencephalic system, which is this one here. And then this one is showing the quadrigeminal system. This is showing the sylvian system. And this is showing the suprasellar system. Then brain. So you need to examine the brain for symmetry. So you need to make sure the sulci and the gyre appear the same on both sides. And you need to take note of gray-white differentiation. So the earliest sign of a cerebrovascular accident on CT scan is the loss of the gray-white interface on CT scan. So you need to compare that from side to side. Then shift. So the pulse should be in the midline with ventricles the same on both sides. And then you need to check for effacement of sulci. Let me show you that. So if you're able to see this is our sulcus. These are our sulci, right? So sometimes if there is a bleed, there will be effacement of the sulci. That's basically you won't be able to appreciate this sulci. Then if you can check now, the right side is almost equal to the left side, right? So they're symmetrical, which is how it's supposed to be. Yes. Then check for hyper or hypodensity. Remember we said that blood appears white, right? It appears lighter. So blood calcification and IV contrast are hyperdense, which means that they appear lighter, and air, fat, and areas of tumor, ischemia, and hypodense appear darker. So basically, if there will be hemorrhage, it's going to appear lighter. If there's ischemia, it's going to appear darker. Then step for ventricles. So you need to examine for the third, fourth, and lateral ventricles for dilation or compression shift. So this is a diagram showing the third ventricle. It's here. This is showing the fourth ventricle. These are the lateral ventricles here and here. And this is our fourth ventricle again. So pathologic processes cause dilation or compression shift. Then this communicating versus non-communicating. So communicating hydrocephalus is first evident in dilation of the temporal horns. Then the lateral, third, and fourth ventricles need to be examined for effacement, shift, and blood. Step 5 bone. So bone has the highest density on CT scan. It's the whitest in appearance, so you need to evaluate for fractures. So this is bone. Okay. So I need to evaluate this for fractures. So that's all on the steps on how to evaluate a CT scan. So talk a little bit about mass effects. So what is mass effect? That's basically if there's hemorrhage into the brain parenchyma, what effects are you going to notice? So there are three patterns of the mass effect. So there's effacement of the cortical sulci. So I hope you're able to notice here, right? There's something. So you're unable to appreciate the cortical sulci, right? So this effacement of cortical sulci, and this compression of the ventricles, you're able to see there's a ventricle here. But this side you're unable to appreciate it. Why? Because there's compression of the ventricle. Then this shift of the midline structures, you're unable to appreciate any midline structure here. Everything has moved to the opposite side. So intracranial hemorrhage. So I've got epidural, subdural, subarachnoid, intracerebral, and intraventricular.